How's it going, everybody? My name is Jesse. Welcome back to Male Nurse Mentor. You guys saw the title of today's video. We're continuing onwards in this series of Correctional Nursing 101. In my most asked questions video in this series, I did include a segment in there about interview prep for correctional nurses, and so many people have been reaching out regarding that template, right? That free email template. I've actually added it now to my website, californiaprenursing.com. You can go in there at your leisure, go in there. I think I just asked for your first name and email and fill that out. You'll actually get a follow-up email, and in there, you'll be able to download that PDF file, all for free. That file that you get is gonna be one that I'm gonna be speaking about today. It's one I created some time ago. Bear in mind, it's not like beautiful or anything, but it is helpful based on the feedback that I've gotten and just from my own experience. It's something that I would have found very helpful going into a correctional nursing interview. So if you're interested in that, go ahead and check that out. I have links in my homepage. I'll include a link here on this video as well. But for today's video, I'm just gonna be going over that template with you guys here in a video format. We're gonna go over pretty much the type of questions, and yeah, go grab that tool there, that template there, as a reference for you to kind of go along with this video. Let's go ahead, let's begin, and good luck to you guys on those interviews. I know it could be daunting, especially, like assuming you don't have any correctional nurse experience, right? It's like going from a hospital to a whole different setting. It could be intimidating, it could be scary, but the thing that I've realized just by being a correctional nurse, I'll tell you here, once you're a nurse regardless. You could be a nurse on a cruise ship, you could be a nurse in a prison, you could be a nurse in a hospital, in a clinic, you're still a nurse. So a lot of those skills that you do already have or you've gained over time, they will translate and they'll transfer into the correctional setting. And if you're a new grad, I know a lot of new grads sometimes are interested in applying to be a prison nurse, a jail nurse. I started as a new grad in a county jail and I survived, I made it. And from there I went on to the prison and onward. Now I work from home. Again, just to reiterate the point, once you're a nurse regardless. So believe in yourself is what I'm trying to say. And it's okay to be nervous. When you get this form from my website, it's free, like I said. There's a couple scenarios here. The first one that I have here is chest pain. I also have one in terms of level of consciousness, seizure. I have one for a stroke, one for a suicidal patient, and other scenarios that are less urgent. So we're just gonna go through these one at a time, and I'm gonna break it down from the perspective of being a prison nurse. So some of these things you would handle a lot differently if someone was coming into the ER, or maybe you're already in a clinic setting. So there's very key points, and I'll make sure to emphasize those. If you see me a little distracted, it's because I do have my dog. This is Jet. He wakes up with me like at 5 in the morning. All right, friends, so for this first one, I have chest pain. I just wrote, inmate Jones is experiencing pain in their chest. You find out there's a medical code. The patient is diaphoretic. What do you do? The main points to hit, you're gonna see on this form here, is first, and always first, you wanna ensure that the scene is safe, always. This is a big difference between working in any other setting and then working in corrections. As in corrections, you always have to ensure the scene is safe. You can do that by asking the officers, hey, is the scene safe? Yeah, it's safe, go ahead and proceed. But always check in with the officers, always kind of observe your surroundings. In a correctional nurse interview, that's a key note to hit. Apart from that, let's say the scene is safe, then you go to assessing the patient, right? You're finding out about possible cardiac chest pain. Well, you have to identify what type of chest pain it is. If you can quickly identify, use your nursing skills, is it cardiac, pleuritic, is it muscular? Try to find out, right? As a nurse, you can kind of do your quick assessment and engage. If you're completely unsure, assume cardiac always, right? And if it's cardiac, likely in this interview, you want to say that you'll initiate 911. You'll initiate emergency responses, right, to come to the facility. Because in a prison, they're not going to treat a cardiac chest pain. They're going to send that out to the hospital. So you want to initiate 911 as soon as possible, especially when you don't know if it's cardiac or not, and you can't rule it out. So main points to hit is the scene safe. If it's chest pain and you can't really decipher what type of chest pain it is, or for a fact, bam, it's cardiac, initiate 911, right? You initiated 911 at this point, then you continue to, if you take your vital signs, if you haven't taken them already, right? We got Jetty right here. Get an EKG, give your aspirin, give your nitro. At this point, you'll likely have a protocol, right? You give the nitro and the aspirin per protocol. You would know this already based off being off orientation, but you could just say it very generically. You'd give nitro, you'd give aspirin, you'd call the doctor. And oftentimes, when do you call the doctor? Well, do you call them before you send out? Do you call them after? If it's cardiac chest pain and it's an emergency, it can be common for you to send out the patient first and then call the doctor after. Hey doc, I sent the patient out to the hospital. I suspected cardiac chest pain. Patient was reporting complaints of chest pain. And from my experience, every doctor's like, yeah, send that guy out, send him out, send him out. So you can notify the doctor after. You also want to notify your supervisor. You also want to initiate an IV if you have the time. Depending in the setting where you're at, when I worked in the county jail, we didn't really do IVs. If we had time in the prison it was protocol to actually initiate an IV before we would send them out. So it just depends where it is that you're working, right? But for the point of your interview answer, you can say that, I would initiate an IV. And then another note here is you'd pretty much say all of that, right? All the things that you would do. But another thing you can point out is if it's cardiac chest pain related or just chest pain related, you would take vital signs every 5 minutes, right? Until the EMS arrives. Main points to hit, friends, I mentioned a few, but make sure the scene is safe. You're gonna see a trend with that for every single scenario here. If you suspect cardiac at all or you don't know, initiate 911 as soon as possible and then run through your motions, right? Run through your checklist. So I did make a note here. It says keep in mind that in a prison, nurses have a protocol. You also need to ensure the scene is safe for you to assess first. Make sure you say that. Make sure you say the scene is safe. So that was cardiac, right? The next example that I have here is regarding altered level of consciousness. So same as before, is scene safe. That's always the very first thing you always have to do. Then you assess the patient, right? Do your quick general assessment, then go to focused assessment, identify the issue, then you proceed with protocol. In a county jail, it's a very autonomous nursing job. In a hospital, from what I've seen from my experience, it's not as protocol heavy. In a county jail, sometimes it's just you leading a group of LVNs, right? If you're an RN, but it's all protocol. So at this point, just start thinking of protocol. You can say that in your response in the interview. And then when it comes to level of consciousness, you do want to identify if it's a drug overdose, right? So look for pinpoint pupils, depressed breathing. And if that's the case, you want to think treating with Narcan. Is it related to low blood sugar? Take a finger stick. And if that's the case, right, think about giving glucose gel first, right, orally. If that doesn't work, think about giving glucagon. So when it comes to an altered level of consciousness, those are the two primary examples I could think of. So think of overdoses, think of low blood sugar when you think of level of consciousness, and think of all the treatment options and the checklist things that you would do for that, right? So another example here I had on this form is seizures. You would see seizures a lot in county jail, a bunch. In prison, same thing. So you want to think of placing the patient on the left side. This is again assuming after you arrive to the scene that the scene is safe. You want to drill that for every single answer. I approach the scene, I make sure it's safe. I observe, I ask the officers. And then when you go up and you see the patient seizing, you're assuming a seizure, you do want to go ahead and clear the area, place the patient on their left side, and avoid putting anything in their mouth, right? Place a blanket under their head if you can, if you have the time, so they don't smack their head and cause even more trauma to themselves. And if it lasts longer than 1 to 2 minutes, think about initiating 911 and calling the doctor to give lorazepam injections. That was just a protocol that I had in the county jail. In the prison, it was a little bit different, but it just depends where you work. But that's like a good mindset to have in terms of answering this question. So just keep that in mind. That's a good general example for seizures. Why are you not sleepy? Why are you not sleepy? I think he wants to go see his brother, but his brother is sleepy. So another example is stroke. For this, think of fast, face symmetry, arm drift, speech changes, and last known well time. If you suspect stroke, always initiate 911 immediately, right? Because time is very crucial, very critical in those moments, right? So when it comes to stroke, think of fast, think of last best well-known time, and always initiate 911 immediately. And of course, just like every other question here or scenario, always ensure that the scene is safe. Is the scene safe every time? So this is one that is honestly something that it happens regularly in a way in this setting, and it's dealing with the suicidal patient. The keys to this, apart from is the scene safe, I'm going to drill that into you, is don't leave them alone, right? When you arrive to a patient, you've been informed they're suicidal, they're having suicidal ideations, they tell you, hey, I'm suicidal. You do not leave them. Say that. I would not leave the patient. I would stay by the patient's side the entire time. Then you notify mental health, you notify the supervisor, you engage with this patient by talking to them, keeping them distracted until the real professional help arrives. So that's all I have for that. Short and sweet, key points there. And then for this very last section, friends, I have some less urgent issues. And when it comes to working in a county jail and a prison, this was very common. These were the most common ones, but it's these less urgent issues. By these less urgent issues, think of headache, think of diarrhea, think of stomach pain, musculoskeletal pain, my knee hurts, my back hurts. Think of a common cold, right? Allergies, seasonal allergies as well. For all of these, you would mainly say you'd assess and follow your protocol. And if there is no protocol, you'd consult with the doctor for further treatment. So when you work in these settings, like I said, the role itself as a nurse in this setting, it's very autonomous. You get a lot of autonomy, which is really cool in comparison to like the hospital. So you do have a protocol. You kind of almost operate like an NP, like a nurse practitioner, kind of like you have your protocol, you see and assess your patients, you make your calls based on your assessments, based on the vital signs, the presentation, and then you treat the patient based off the protocol. So for all these non-urgent issues, that's how you would approach it. You would assess the patient. Why are you so grumpy? Why? You're acting like you're not sleepy. He's just acting like he's not sleepy. So for all of these, you would pretty much follow your protocol. You'd assess the patient, look at the presentation, and make a judgment call. And if for some reason you don't feel comfortable, right, or there is no protocol for what you're seeing, then you definitely consult with the doctor, whether it's in person, the doctor that is there on site, or via telephone. You just give the doctor a call. So that's going to be it, friends. I just have been sharing this template for some time now, and I wanted to actually make a video on it. A lot of people have been requesting, and so here it is. So adding it to the series, make sure you go to my website, californiaprenursing.com, if you want a copy of the actual tool itself, and use it as a reference if you have an interview upcoming for a correctional nurse job. And I'm gonna go put Jet to bed because he is continuing to still try to run away. You gonna say hi? See you guys on the next one.